Hi, this is Dr. Bhargava. I have a few interesting cases to share with you in this short video. Our first patient presented with a whole body bone scan, and on the bone scan we can see here that we have an anterior and posterior image in a higher intensity and a anterior and posterior image in a lower intensity, showing this focus of uptake at the superior pole of the right kidney. There is no evidence of osteoblastic bone metastasis. There is some degenerative change in the cervical spine, lumbar spine, and also in the shoulders, sternoclavicular joints, and hands bilaterally, also the left knee. And so what do you make of this focus of stasis in the superior pole of the right kidney? So incidentally, this patient got a CT scan of the abdomen and pelvis, and interestingly enough, we found several stones in a cystic focus sitting right there in the right kidney, seen here on the coronal image at the superior pole, and I have windowed it so that you're able to see these multiple hyperdense stones clearly, compared to soft tissue windows here where we see the cystic focus, some non-dependent fluid, and all of these dependent stones. So it's a lesion where there is stasis of urine to such an extent that stones have developed, and so they have a calyceal diverticulum, which was also seen on a MRI that was performed for another reason. We are looking at contrast enhanced images. So on the left we have T1 fat saturated non-contrast or pre-contrast image. Then we have the arterial phase, portal venous phase, and the delayed phase. And on the delayed phase, we find that there is urine that, or contrast that has been excreted in the urine, getting into this calyceal diverticulum and going around the stones that show no signal. So this patient has a calyceal diverticulum that was first seen on the whole body bone scan and then further characterized by CT and MR. Here is a diagram showing how a calyceal diverticulum would look like. So on the right we have a graphic of a normal kidney. So this right here is a minor calyx, and these minor calyces join to form a major calyx, which is right here, and these major calyces then join to form the collecting system, and that continues to the ureter. And so sometimes there is a diverticulum that develops from the calyx, and it can look like this, shown right here, and then urine can go in and come out of this diverticulum, and because there is a space that is created, there is stasis of urine, and like we saw earlier, it can lead to stone formation. This is our next patient. They underwent a FDG PET-CT scan as a follow-up for lymphoma, and there is no evidence of hypermetabolic lymphadenopathy in their whole body FDG PET-CT scan. We do see some heterogeneous increased uptake in the bone marrow, and that is from treatment related to lymphoma. And the interesting finding here is in their left groin, where we see this focus of intense uptake, and this focus corresponds to this ring-shaped activity that is seen on this fused PET-CT image, and the corresponding CT shows some fluid signal and some surrounding fat stranding. And so what's going on here? So these are images from their diagnostic contrast enhanced CT, where we can see that there is some fluid. The fluid shows some rim enhancement, and there is some fat stranding. So they have developed an abscess in the left groin that was incidentally picked up on FDG PET, showing peripheral or rim hypermetabolism and FDG uptake. This is our last patient, and this is interesting because they have several artifacts on the single image of their DXA scan from the spine. And so the technologists have labeled the vertebral bodies, and right next to L1 we see a device, so we cannot use this for analysis. At the level L4, L5, there is posterior fixation. We see the hardware that they've tried to remove from the image, but we cannot use those vertebral bodies for analysis. So the only vertebral bodies that we are left with for good analysis of the bone mineral density in their lumbar spine are L2 and L3. And so the ancillary results that also are available as a part of the analysis show that the L2, L3 vertebral body has a density of 1.239, a t-score of 0.3, which is normal, and the z-score of 0.9. And so because the t-score is normal, we can call L2, L3 as normal bone mineral density. So it's important to look at the image and to exclude the vertebral bodies where there are artifacts or compression deformities. Well, if there are compression deformities, then you want to recommend plain films for better evaluation, because those could be insufficiency fractures. And if there are artifacts like here, like we see on L1 and L4, we want to exclude those vertebral bodies and include, like in this patient, only L2 and L3. Thank you for watching.